Hello and welcome to my channel Ace Your MRCP. I am Dr. Aparajita Roy, Registrar, King's Hospital, London, and in today's video I am going to give you exclusive tips that will help you crack any NHS job interview. So let's get started. Now, be it an MTI job or a non-training job interview in the NHS, the basic structure of the NHS interview remains fairly constant. These days, most of the NHS job interviews take place remotely via Microsoft Teams or Zoom. You will be sent a meeting invite roughly 1 to 2 weeks before the scheduled interview date. Make sure you choose and book your interview slot, which is usually done on a first come first served basis. Please be aware of the fact that the interview times are based on the UK time. You have to calculate the time according to your locality and then you have to be prepared at the scheduled time. Now let's talk about the pre-interview checks first. Make sure you have your laptop or computer ready with a microphone and a webcam, and also with a steady internet connection. Dress smartly and professionally and be prepared on time. Make sure your background and your face is well lit and visible on the camera. Keep a pen and paper handy to scribble any notes that you might have to jot down during the interview. Take a moment to calm your nerves, gather your thoughts, and then dial into the meeting. The interview panel usually consists of 3 to 4 team members, including clinicians, your line manager, and HR manager. One of them, usually your line manager or your HR manager, will take the lead, welcome you into the interview, introduce you to the other panel members, and explain the structure of the interview to you. At this point, smile a lot, greet your panelists well, and look confident. Also, try to look at the camera or the webcam of your computer instead of looking at the computer screen. This will give an impression of eye contact to your interview panelists. Now let's talk about the parts of the interview. A typical NHS interview lasts for roughly 30 to 40 minutes and is divided into 5 to 6 parts. The first part is introduction. And the questions in this part are pretty standard and predictable. You can expect questions like, please tell us more about yourself, or please introduce yourself. It is very important that you prepare for this answer well and rehearse many times in front of the mirror before you appear for your interview. Please be aware of the fact that the team member in the interview panel are already familiar with you via your detailed CV. So there is no point in going through each and every point in your CV over and over again. Highlight the skills you have that are relevant for this job, and also you can stress upon any relevant courses or experiences that sets you apart from other candidates. Now please never ever lie in your CV or talk about the skills or experiences that you don't have. Another standard question that you can expect during this stage of your interview is, why do you want this job, or what are your aspirations in this job, or why do you want to work with this trust? Again, be very honest and truthful. There is no shame in saying, well, I want to apply for training and before that I want to gain some more clinical experience, or I want to build my CV. Familiarize yourself with the trust's values and principles, and you may want to incorporate those points in your answers. Again, prepare for this answer from before, rehearse well, and when the time comes, deliver it in front of the panelists. The second part of your interview will comprise of a clinical situation. Now, usually at this point, a second member of the interview panel, usually a clinician, will give you a clinical scenario. If you are applying for a medicine job interview, you will be asked about an acute medical scenario, for example, DKA or seizures or COPD. It is a good idea to use your pen and paper to jot down all the information that are given in the question by the interview member. And there is a definite structure to approach these questions, so prepare them well from before. Number 1. Always start with ABCDE approach. Number 2. Talk about the relevant investigation that are required at this point. Be very simple and basic, like ECG, X-ray, blood investigations. Don't talk about anything fancy, and definitely don't mention anything that you don't know about. Number 3. A good candidate at this point will also talk about escalation plans. For example, if you are applying for an SHO or an F2 or a junior clinical fellow role, mention that I will discuss this sick patient with my registrar. If you are a registrar, then say, well, at this point I will think about escalation plans. If the patient is sick, I will get critical care input sooner rather than later. And if you feel relevant, you would also discuss DNAR status at this point. Also, if you feel, you might need to highlight this patient to your consultant.
Prepare frequently asked topics from standard books like Oxford Handbook of Clinical Medicine. Also, you should be aware of relevant NICE or SIGN guidelines for conditions like TIA, asthma, COPD, or BTS guidelines for pneumothorax. Also, you should be prepared for approach-based questions like how would you approach a patient with sudden onset shortness of breath or acute onset headache. Now, working in the NHS, it's very important that you look for red flag signs and make provisions for investigations to rule out life-threatening conditions. For example, don't forget to mention investigations like in a patient with acute onset headache, you should think of subarachnoid hemorrhage as one of your differentials and plan investigations like lumbar puncture or CT angio to rule out subarachnoid hemorrhage. Now, patient care in NHS revolves around multidisciplinary team meetings. So, wherever relevant, mention about that. For example, mention that you would get in touch with your microbiology department to make relevant antibiotic choices. Don't forget to mention that you would like to hand out information booklets for your patients in outpatient based scenarios. And please remember that in the NHS, local trust policies and guidelines are strictly adhered to. Mentioning these points in your answers will give the impression to the interview panel that this candidate has made an effort to go through the comings and goings of NHS. A couple of pro tips to set you apart from other candidates. Never mention fancy investigations or treatments that you're not familiar with or something that is not used in day-to-day life. And escalate, escalate, escalate. Remember, as an international doctor, you are not expected to know the nitty-gritties of NHS in your first job. The interview panelists are looking for a doctor who is safe. And if you mention that whenever in doubt, I will ask for senior help or ask for help from my colleagues, the interview panelists will be rest assured that they are looking at a safe doctor.
If you are enjoying this video, please give me a like and subscribe to my channel. Now, number 3 in the structured interview would be leadership questions. Now, if you are applying for middle grade jobs like registrar or beyond, you may be given a leadership scenario to test your leadership skills. And these can be quite fancy. For example, you may be asked, you have walked in as a registrar on your night shift where you are told that there is one SHO short in your team, there are no medical beds, and there are 20 patients waiting in the ED, of which 2 are quite sick in the resus. How would you approach this scenario? Once I got asked that you're walking 15 minutes late in a morning clinic, you have 20 patients waiting, your secretary walks in and hands you a patient complaint letter, and you find that your registrar is off sick. How would you approach this scenario? Now, if you have never worked in the NHS, Answering these questions can be quite tricky, but don't worry. The interview panelists will be aware of it and will make certain concessions in your answer. But again, keep it simple, nothing fancy. Be honest in your approach and show your integrity. Answer these questions in a calm manner.
Familiarize yourself with ethical scenarios like duty of candor, consent, confidentiality, autonomy, etc. Again, if you have never worked in the NHS, the interview panelists will be aware of that and make concessions, but be prepared well with these scenarios and again answer them in a calm manner and emphasize that you are aware about these ethical principles that are used in day to day NHS work.
The next part of your interview will comprise of audits and quality improvement projects. Again, if you have never worked in the NHS, you might not have audit or QIP experience. But it can be a good idea to read about the basics of audits and QIP to prepare for your interview. If you have already done any audit or QIP project, that's good. Prepare some basics about it so that you can talk if you are faced with this question. Again, the interview panelists will be aware of the fact that you have never worked in the NHS and you might not have a practical experience of working in an audit or a QIP. But don't worry, show your willingness and say, well, I'm interested to do an audit or a QIP as a part of my role in this job. Same with posters and publications. If you have them, good. Prepare a few lines so that you can talk about them. If not, don't worry too much. Now the next section in your interview could be, do you have any questions for us? Now this is my favorite part in the whole interview. Please be aware of the fact that this is still very much a part of your interview and you're still being judged on the answers that you deliver in this part. Again, prepare for this section well. There are definite questions that should not be asked at this stage. For example, please don't talk about salary as you've not got the job yet. Ask about any research opportunities, any training opportunities, whether there are any facilities for Caesar training in this role or not. Also, if this is your first NHS job, a good question would be to ask about shadowing. This gives the interview panelists an idea that this candidate is aware of the challenges that he or she might face as the first job in the NHS. So, asking about shadowing is always a good idea. Now, by this time, the panelists might have made some judgment, so expect one last question. If you are selected for this job, how quickly can you join the department? Again, be very practical about answering this question. If you're already in a job, be aware of the notice period, which can range from 1 to 3 months. If you need a visa, this would be a good point to remind the HR manager that you would need a certificate of sponsorship. A good way to answer this question would be, I am eager to join in this role as soon as possible and as soon as all the paperwork is sorted. And that's it. Smile a lot, appear confident, be polite, be truthful, be honest, and be humble. That's it for today, guys. Let me know in the comment section below how you like this video. Also, let me know what other topics you would want me to make videos on. Till then, stay safe, keep studying, and ace your MRC.